Thank you, Chairman. And thank you, Director Bertagnolli, for being here with us today and for coming to testify. I'm specifically interested today in hearing from you, Director, on how you have worked to increase engagement on women's health matters, as well as what has been done to include more Hispanic representation in studies, particularly in research dealing with Alzheimer's and cancer. And it was already asked in general terms on women's health, so feel free to touch on that if you want to, but because it's already been covered, I'm going to jump right into the second part here of what I mentioned. Thinking specifically about cancer, the University of Arizona is a Hispanic serving institution, proudly hosts a comprehensive cancer center, where currently research is being done to understand how cancer, like breast cancer, lung cancer, or ovarian cancer, are specifically impacting Hispanic communities. What is the NIH doing to support these endeavors, and what does the NIH need to ensure recruitment and retention of women, especially from those underrepresented groups, into clinical research?
So, yes, thank you. You hit such a core topic and principle for me. You know, biomedical research has to include everyone, and it matters, okay? We're the genes we inherit, but we're also our society, our environment, where we live, what we eat, our culture has profound influences on health. So including diverse cultures, like I know the Hispanic community is how many different diverse cultures, right? It's certainly not a monolith either. This is why I don't think we can really do our job unless we bring our research inclusively to really every community in the nation. This sounds like something that couldn't be done. It absolutely can be done in a very positive way. I'll say it again. We have a plan to do this with the Care for Health program. And the last thing I will say in there is I fully expect that not only will this program give us the data we need that says this is how a Hispanic community in Arizona is different than a community in northern Montana in respect to what we need to do for health. It will also, in those parts of the United States that really have poorer health and poorer health care, raise the quality of their health and their health care because we are in there doing research. If lots of
I'm
saying
definitely focusing, hoping on that as well. When it comes down to finding those, getting those findings, and regarding the efforts you're already working on, what timeline around that are you looking at? When can we get some of this information?
Well,
I've asked Secretary Becerra about this as well, and I get a positive response and an openness and optimistic engagement, but I don't know if I've seen actual progress or data on this.
Well, as I said, we stood up this new community research enterprise in 1 year. We're having our first investigator meeting in 2 weeks to launch the studies. And we're launching studies that that are already ongoing, that these communities will participate in, just to really supercharge it, to get it running and start getting results immediately. And those studies will be about what the communities need: pain, nutrition, substance abuse, maternal health, all the core issues that those communities need.
Okay, let's jump into something that also impacts the group that I'm talking about here directly, switching to Alzheimer's. I've been learning a lot about this disease. I've been working very closely with my community in Southern Arizona on this. I've jumped with both feet in on helping here and doing something about this. My neighbor was recently impacted by this, my neighbor's wife. So it impacts, once you really start paying attention, it's out there way more than I think most realize until you start really looking into it. So researchers, again, at the University of Arizona estimate that by year 2060, the Hispanic population will at least double the size, and that the Hispanics are about 1.5 times more likely to be diagnosed with Alzheimer's or dementia. So what is the NIH doing to understand these trends? And also on that, what can we do to ensure that the Hispanic and Latino populations are being sought and included in these clinical trials also?
Yes, so Alzheimer's disease, incredibly complex issue that lots of generous funding coming to the NIH has really helped us take an incredibly comprehensive approach, okay? And this is our mantra. It is the fundamental science. What are the genetics of Alzheimer's disease and how do they affect people's risks? What is the environment and what are those contributions? And critically, and use those tools to develop new treatments, but not ignoring the role of prevention, right? You can't start managing Alzheimer's disease when somebody is 55, 65, and they're already exhibiting symptoms. We have to be able to detect it so much earlier and to intervene with people at risk far before to prevent them or at least ameliorate the symptoms that they have, keep them healthy and thinking and with us as long as possible. So there are efforts across that whole spectrum. And I will say, I also have an iron-fast commitment that anything we do in the development of these new therapies will get to every single community.
Thank you. And thank you for that answer. Out of time, Chairman. Thank you.